Resistance training isn't just about building muscle, it's a powerful tool for heart health. Adults who lift regularly have about a 15% lower risk of all-cause mortality and a 17% lower risk of cardiovascular disease, compared with people who don't resistance train at all. And the biggest benefits occur with just 30 to 60 minutes per week. Yet despite this, only 28% of US adults meet the recommendation of doing resistance training at least 2 days per week. In the article, titled Resistant Exercise Training in Individuals with and Without Cardiovascular Disease, the American Heart Association provides an updated review on the cardiovascular benefits of resistance training and how to prescribe it effectively. This is Talking Sports Science with a summary of their article. Resistance training improves several traditional and non-traditional cardiovascular disease risk factors. Let's first take a look at the benefits of resistance training on traditional cardiovascular risk factors, including blood pressure, blood sugar control, lipids, and body composition. It's important to note that most of the evidence in this area comes from 2 to 6 month programs using moderate to high intensity resistance training, about 40 to 80% of maximum effort, performed 2 to 3 times per week. First of all, resistance training lowers resting blood pressure across age groups. In adults aged 40 or younger, there are small but significant reductions in diastolic blood pressure of about 1 mm of mercury. In adults over 40, resistance training results in larger reductions in blood pressure, with systolic pressure decreasing by about 4 mm of mercury, and diastolic pressure by about 2 mm of mercury. In people with prehypertension, the effects are even more pronounced, with reductions of about 3 mm of mercury for both systolic and diastolic blood pressure. And in individuals with hypertension, systolic blood pressure decreases by about 6 mm of mercury, while diastolic blood pressure decreases by about 5 mm of mercury. Moving on to glycemia, or blood sugar control, which is another big area where resistance training helps. It makes your muscles more responsive to insulin and better at pulling glucose from the bloodstream. As a result, people who lift regularly have a 17% lower risk of developing diabetes, and fasting glucose typically decreases by 2 to 5 mg per deciliter in older adults with pre-diabetes or type 2 diabetes. For people with type 2 diabetes, long-term blood sugar levels, measured by A1C, drop by about 0.34%. Overall, these benefits tend to plateau about 60 minutes of resistance training per week. Regarding resistance training and lipid profiles, resistance training produces modest but meaningful improvements in blood lipids. HDL, often called the good cholesterol, increases by about 2 to 12 mg per deciliter. Total cholesterol decreases by about 8 mg per deciliter, and triglycerides, a type of fat found in the blood, drop by about 7 to 13 mg per deciliter, whereas the evidence for LDL or bad cholesterol is less consistent. And for adults who are overweight or obese, resistance training alone increases lean mass by 0.8 kg, decreases body fat percentage by 1.6%, and decreases whole body fat mass by 1 kg. Resistance training may not cause clinically significant weight loss, but it improves metabolic health and may help prevent weight gain over time. Now that we've covered the traditional cardiovascular risk factors, the ones we commonly measure, let's look at several non-traditional cardiovascular risk factors that resistance training also benefits. Resistance training improves overall cardiorespiratory fitness by increasing VO2 max by 1 to 3 ml of oxygen per kilogram of body weight per minute, producing similar improvements to aerobic training in people with heart disease. Resistance training also lowers inflammation, especially in people with high cardiometabolic risk. Low to moderate intensity resistance training reduces arterial stiffness, but on the other hand, high intensity resistance training shows mixed results. Fibrinolysis, the body's ability to break down blood clots, may improve with resistance training without increasing clotting risk. Endothelial function, which refers to the inner lining of blood vessels, improves by about 2 to 3%, helping blood vessels dilate and improve in circulation. Resistance training reduces depression and anxiety and improves the quality of one's life. It also consistently improves sleep quality, although the effects of sleep duration are mixed. People often ask which form of exercise is better. However, combining aerobic and resistance training appears to result in the greatest reduction in cardiovascular risk factors compared with either modality alone. Compared with no physical activity, combined training is associated with a 40 to 46% lower risk of all-cause and cardiovascular disease mortality, whereas performing either resistance or aerobic training alone is associated with a risk reduction of about 18 to 29%. Moving on to resistance training guidelines. For healthy adults, the American Heart Association recommends starting with 8 to 10 different exercises, targeting all major muscle groups, using machines, free weights, or even just your body weight. Each exercise should be performed between 1 to 3 sets of 8 to 12 repetitions, at a moderate intensity, about 40 to 60% of your 1 rep max, and doing this just 2 times per week, while including rest days between sessions, is enough to produce meaningful improvements in both strength and cardiovascular health. However, resistance training can be adjusted depending on the individual. Low-intensity resistance training is most appropriate for people with clinical conditions or high-risk individuals. It helps reduce strain while still providing meaningful health benefits. Moderate intensity, around 40 to 60% of your 1 rep max, is the recommended starting point for most healthy adults. This is the range that improves both muscular strength and endurance, while also providing cardiovascular benefits. At higher intensities, using loads above 80% of your 1 rep max, training is typically focused on maximizing strength and is best suited for more experienced individuals. So once you've found your starting point, the goal is to gradually increase the challenge over time. You can do this by adding a little more weight, increasing the number of sets, or training slightly more often. This is progressive overload, and it's essential for keeping your muscles adapting and getting stronger. A simple way to apply this is the 2 for 2 rule. If you can perform 2 extra reps beyond your target for 2 workouts in a row, it's time to increase the weight by about 2 to 10%. After about 6 months of consistent training, and if there are no medical limitations, you can begin to use a wider range of rep schemes and heavier loads, even above 80% of your 1 rep max, while using longer rest periods between sets. Before wrapping things up, it's important to briefly cover safety. There are some absolute contraindications, meaning resistance training should be avoided until medical clearance is given. This includes serious conditions, such as unstable heart conditions, severely high blood pressure, serious heart rhythm disorders, or other high-risk cardiovascular issues. There are also relative contraindications, where training can still be safe, but should be done with medical guidance. Examples include individuals with pacemakers, diabetes, controlled hypertension, musculoskeletal limitations, or a history of stroke. And no matter who you are, if you experience signs and symptoms like dizziness, chest pain, unusual shortness of breath, or heart palpitations, you should stop training immediately and seek medical evaluation before continuing. That said, resistance training is beneficial and safe for a wide range of populations, including women, pregnant and postpartum individuals, older adults, and people living with chronic conditions such as cardiovascular disease, chronic kidney disease, HIV, or cognitive conditions like dementia. The key is that the resistance training programs should always be individualized, tailored to each person's abilities, health status, and goals. And that concludes this summary of the article titled Resistant Exercise Training in Individuals with and Without Cardiovascular Disease. As always, I recommend you go and check out the full article. The link is in the description. Thanks for watching, folks. See you next time.